Last month, schools across Vermont began implementing a program designed to allow students considered close contacts of a student displaying COVID symptoms and who might otherwise have been sent home out of an abundance of concern that they too might have the COVID virus and could spread it around to other classmates and to other people at the school to remain in school and continue their normal school day. Known as Test to Stay, the program is designed to determine if unvaccinated, asymptomatic students aged 5 and older, and staff who are close contacts of a positive COVID-19 case can safely stay in school and not lose in-person instructional time. Antigen or rapid response COVID tests are administered. If a student receives a positive antigen test, it's the responsibility of the parent or guardian to pick up the student from school. According to the state's Agency of Education, they will not be permitted to ride the bus home, as they are now considered a positive COVID-19 case. Unvaccinated, asymptomatic students who have been in close contact with an identified positive case, in the same class for example, are allowed to stay in school as long as they have negative results from a rapid antigen test for 7 days in a row. So how's it going in some of the area schools? To find out, we met up with school nurses at Arlington and Burton, as well as with Deborah Fishwick, the co-principal at the Manchester Elementary Middle School. We also had a chance to discuss the program with Dr. Daniel French, the Secretary of the Agency of Education. On a Zoom call, we first met up with Lori DeStasio, who's the district nurse for the Arlington schools, Fisher Elementary, as well as their high school and middle school.
The main goal is to minimize lost learning time and lost in-school time for unvaccinated students and staff, if there is any. And what would happen is if an individual is identified as a close contact to a COVID case, if that person was in school while infectious, as an alternative to staying home and quarantining, Test to Stay allows unvaccinated students and staff to attend school while having an antigen COVID test done at school first thing in the morning up until or after day 7. We have our contact tracing teams. We've got 2, one for our middle and high school and one for down here. Down here, the team is myself, our principal, and our administrative assistant. And at the high school, it is Erin Pickering. She's an LPN, and the principal, and she has a couple assistants up there, and I'll also lend a hand if needed. And we try to, as soon as we hear of a positive case, we get to work right away figuring out who the close contacts are so we can notify them.
So how many students have been tested so far as part of that? Many or?
Sure. We began using Test to Stay this Monday, and so far this week we have tested 21 individuals. So we've saved 21 school days so far, which is pretty amazing. Prior 90 days of school from August until Thanksgiving, our high school, we've had 15 cases. Down here at the elementary, we've had 7. Those are just the cases of individuals who were at school while infectious. And as a result of those cases, we've had a lot of lost learning days. I couldn't tell you exactly, but Erin and I tried to estimate. And at our high school, we had about 61 unvaccinated close contacts that had to quarantine due to the cases. And down here, we had 79 unvaccinated students have to quarantine. And on average, when a student is a close contact at school, they've got to quarantine at home for 7 days, and then they may take a PCR test on or after day 7. So the lost school time varies depending on when the case was discovered. So on average, we estimate that each unvaccinated close contact before Test to Stay would be losing about 5 school days, sometimes more. We're watching the news and we're watching the cases go up, and we're very concerned. I try not to look at the numbers too much, but usually what we see in the community is what affects the school. Most of the cases that we've had have been community acquired. So they don't happen. People aren't getting infected at school. It's as a result of the infection rate in the community. So it's very concerning that we only have 2 nurses in our Arlington district, and we are quite busy following up with ill students and advising parents to keep children home with coughs and runny noses, and following up on absences. There was a time when we didn't follow up with every single student who was absent, but if a student doesn't come to school, we do make sure we have some contact with that parent to verify that they didn't just have a small head cold and they come back to school the next day. So it's a lot of tracking. And it's challenging when there are multiple cases in the school system per week because it's very labor intensive.
Then we headed up to Burnburton Academy, where we had a chance to talk with their school nurse, Megan Beatty-Kassan.
Yeah, so the Test to Stay program is one of about 4 testing options that the schools in the state of Vermont can provide. The first option is the surveillance testing program, which is weekly testing on the same day every week, and BBA has been providing that for the last 12 weeks. We're one of few schools that do that. And that's a program where students and staff can opt in to test every Wednesday or just every other or a random Wednesday. And what that does is it allows us to capture any asymptomatic positives that could potentially cause cases in the school. Then there's the Test to Stay program, which is designed for unvaccinated close contacts, students or staff. We're lucky here at BBA, we're about 99% vaccinated in our staff, and we're 84% at immunity level in our students. So the Test to Stay is designed for unvaccinated students who would be close contacts, otherwise required to quarantine, which of course would keep them out of the classroom. Even though there is a remote option, it's still not the same as being in the classroom. So actually today was the first day that I had students that participated in the Test to Stay program, and it went pretty smoothly. So what they do is they come in, they're allowed to ride the school bus. They'll arrive at school. I meet them outside or a negative pressure room, and they perform a self-test with an antigen. So it's a 15-minute turnaround time for the result. If the student is asymptomatic and they test negative, then they go on to class. We repeat that for 7 days. If a student is symptomatic and they test negative, they're sent home based on symptoms and are given a PCR test that they can send out for a confirmation to rule out whether that negative was false negative or if they are in fact positive. So that brings us to another type of test, and we have the in-school PCRs and the send-out PCRs. And so the in-school PCRs can be used, we can contact, the state is contracted with Green Mountain Courier, and so this allows for courier services to pick up on any given day. So if we have, say we have a handful of students arrive to school and they have symptoms, I have the ability to test them on site, send those samples down to CIC in Cambridge and Massachusetts, have them tested, and the students will get their results sent to them via email. Then there's also the send-out PCR, and that send-out PCR is a take-home kit that can go home with symptomatic students or staff or actually their families, and that is in a we wouldn't say postage paid, but prepaid envelope that goes by UPS. So there's several different testing options. You're asking mostly about Test to Stay, and the intent with Test to Stay just really helps keep students in school so they can actively learn in person. And I think it's going to be pretty beneficial. We started this week. We rolled out our surveillance testing 12 weeks ago, and we were fortunate. Out of those 12 weeks, only 3 of those weeks did we have any positive cases return, which makes me remain hopeful that we can continue on that trend as we head into the winter months. So we did implement the in-school PCR, the send-out PCR, and the Test to Stay. We implemented those this week. The interesting thing about Test to Stay is that the students are allowed to come to school based on the negative antigen, but they do have to continue to quarantine outside of school. So this weekend, the students will be following the same quarantine rules that have existed through this pandemic in their homes. But they are allowed to attend school with a negative antigen test, which is interesting.
After that, we headed over to the Manchester Elementary Middle School, where we heard from Deborah Fishwick, one of the co-principals there.
So for us to do Test to Stay, parents need to complete both a consent form and a registration form. And that happens following a positive case in a classroom. So if we have a student who's been identified as COVID positive, we reach out to all of the families and send them information, and we ask that they complete the consent and registration form. And then the Test to Stay is 7 days. And if that 7th day falls on a holiday or a weekend, it's that following return to school date. So far, we've had Test to Stay for, I want to say 5 or 6 classrooms so far this year. And the nurse and I have been working collaboratively to make sure that happens. We have someone outside directing traffic. We bring kids in, we sit them down. Last Monday, we did 59 tests in under an hour. So
wow. That sounds like a lot of tests very quickly.
It is a lot of tests, but we like I said, we have a system. Dr. Lowe is here, and she was helping make sure kids were registered on the computer. If they weren't, she was that lead to the families to make sure they had all the paperwork filled out. Our nurse would hand the swabs off to me, and we would put them into the test cards with the antigen or the solution, and then we did it. We wrote names on cards, and we just had them lined up, and we had kids separated, and they waited 15 minutes, and fortunately we had all negatives. So we were able to let the kids head out to their families in the car, let them know, and then they were up in their classrooms.
So how are students selected for these tests? Or do they have to be showing some sort of symptom?
So if they're symptomatic, they would not be part of the Test to Stay program. If they're symptomatic, they would have to go to their doctor for a test. Test to Stay is for students who were a close contact in our school community and identified by, so if we have, for example, a student in a kindergarten classroom, test positive, that class would have the option of Test to Stay, or they would have the option to quarantine. Some families are not willing to participate in the Test to Stay, so therefore those kids have a return to school date of 7 days with a negative PCR, or 14 days if they choose not to test. But we found, we have a handful that don't want their kids tested and just opted to keep their kids home administering those tests.
And what's been the general reaction so far from parents and students and staff to all of this? Has it been basically supportive and
Basically,
positive?
it has been supportive. The kids were really cute. They, the second day we did, or the first day we did Test to Stay, we had one little boy who was reluctant to let us do the test, and we sent him back out and told the parent, like, look, he's not letting us do the test, so he'll have to go home unless we can get him to test. And he came back in, and his classmates were cheering him on. You can do this, you've got this, it only tickles a little bit. And then they'll come back the next day, oh, it wasn't so bad, it was better today than it was yesterday. So they're cheering one another on and being supportive of, the kids are being supportive of each other. And for the most part, parents are very supportive of the process. They would rather have them here in school, even if it means dropping them off a little bit later and waiting 15 minutes for us to get those results out to them.
And finally, we heard from Dr. Daniel French, the Secretary of the state's Agency of Education, who told us the view from his perspective.
It's going really well. I think, it has a couple goals, certainly to keep kids safe and schools safe, but the other side of it, and I think this is what's attracted us to Test to Stay, is keeping kids in school better. I think, the essential tool we had before, which is related to implementing Test to Stay, is contact tracing. And contact tracing has been very challenging in the environment of Delta. Delta has been much more transmissible. It moves a lot faster. So sort of the contact tracing machinery, if you will, and that process breaks down, gets backlogged pretty quickly with Delta. So test to stay, really helps, I think, with some precision in terms of keeping schools safe, where contact tracing was leading to some broader quarantining of students and broader isolation of students. Test to stay allows us to get a little more precise on that and focus in on specific children while keeping them in school. The challenge is, how do you make the transition from doing sort of that sole sort of process based on contact tracing to implementing something like test to stay, when the folks that are doing that are both wearing the same hat, so to speak. So where we've had districts with higher case counts, they've had more difficulty making the transition to test to stay because they're deeply involved in the contact tracing process as well. But I think all in all, what we're seeing, and it's just my observation hearing directly from school districts, that it does work. It's a very, very useful strategy, both in terms of managing the public health aspect, but also keeping kids in school more regularly.
So are all the schools in the state now participating, or is it still in a state of being rolled out?
Yeah, it's in a rollout phase. It's really up to them. There's been a steady increase in the rollout. I think we have all but 2 school districts signed up for it. So there is a onboarding process where the districts have to go through some training and provision, basically the information systems on the back end that allow us to track the data. So pretty much every district in the state has at least done that. I cited at the press conference the other day, we've seen about a 30% increase in the number of schools sort of ramping it up. So over half of the schools are doing test to stay right now. I think that's a fair assessment. So we've seen a steady increase in that. And I would note also that very recently, sort of in the post-Thanksgiving conversation, there's a lot of schools have new energy behind this. So that's sort of been our challenge, and that's a challenge we welcome at the state level. But we try to work with districts in advance of elevated case counts so they can get situated doing it, and they're busy. So they definitely, then they reach out when they're in the middle of a heightened case count, and we're like, can we turn this on overnight? And we're like, yeah, we can work hard to try to do that, but we would prefer like a week heads up time to start planning the ordering of supplies and so forth. But and the other thing I'd point out too is that it's really an activity. We're largely talking about challenges at the elementary level versus high school. High schools have been operating very stably because the vaccination rate's much higher there than it is at the elementary level. So a lot of what we're seeing when we talk to school districts about the logistics, it's important to acknowledge we're talking about elementary schools. Elementary schools bring a whole different challenge. If you remember what it's like to be at elementary school is a whole different animal in terms of working with smaller children, getting them to test and so forth. It can be a lot of fun for them, but it's also logistically, it's a whole different dimension. And I just want to acknowledge that because I was at a vaccination clinic a couple of weeks ago, and to watch the 5 through 11 vaccination versus the adolescent vaccination. Adolescents kind of move through like adults. With 5 through 11, they have stuffed animals. There's a lot of talking with the child, the parents there. I mean, it's a slower process. So, that's not an unimportant variable to acknowledge as well, that the elementary aspect of this brings its own challenges.
At this time, the Test to Stay program is being used only for in-school close contacts. The data on Test to Stay is based on school setting exposure, not community exposure. For the GNAT-TV News Project, I'm Andrew McKeever.